Camera off.
Can you see us now?
Yes, I can.
Hi, my name is Laura, and I'm an intern at Leadership Initiatives. Today I'll be helping to diagnose you. Doctor, can you please ask if it's all right for me to ask the patient a few questions and for him to introduce himself?
So za ka dan maka tambayoyi. So za ka ba da mako. Go on.
So first I'd like to ask the patient, what is his name and how old is he?
Ya sunanka? His name is Yusho. Yusho.
Okay. How old is the patient?
He's 25 years old.
What does his day-to-day life look like? Does he work? Was he going to school?
He's a businessman.
All right, can you ask the patient what brings him here today and what is his main symptoms?
He has fever, headache, and dizziness.
Can you ask him if his fever is going, is it continuous or is it sometimes there and then it's sometimes gone?
Okay, zazzabin yana sauka zai dawo. The fever is on and off.
Has the patient been feeling any muscle pain, tiredness?
Akwai ciwon jiki? Akwai kasala? He has muscle pain and tiredness.
Does the patient have any abdominal pain?
Akwai ciwon ciki? Yes.
Is the patient experiencing any other stomach issues? Like, does he have diarrhea? Does he have constipation? Is he vomiting? Is he nauseous?
Akwai amai. Akwai zawo. Bayan gari, shin bayan gari fa? Akwai shin bayan gari? Akwai shin bayan gari? There is nausea, vomiting. There is diarrhea, no constipation.
Wait, so he does have diarrhea or he doesn't?
He does have diarrhea.
He does have diarrhea. Okay. Does he have a sore throat? Any coughing?
Akwai ciwon wuya in ka haɗa miyau akwai zafi. In ka haɗa miyau akwai zafi. Okay. Akwai tari. Has cough and sore throat.
Right now, I would like to run a rapid diagnostic test as well as a blood culture.
Okay. The rapid diagnostic test is positive.
What about the blood culture?
Positive.
Can I also run a microscopy as well as a full blood count?
Okay, the full blood count, the hemoglobin is 10.1.
And then the
and
microscopy.
then the 2+.
Okay. Is the patient having any difficulty breathing, chest pain, there's nasal congestion?
There's nasal congestion, chest pain, no difficulty breathing.
Wait, there is or there isn't difficulty breathing?
He doesn't have difficulty in breathing. Did you get that?
Yeah, I did get that.
No breathlessness. Okay.
No. And you said that the patient's blood culture came back positive.
Yes.
Okay. Just because the patient is feeling like a sore throat and like I think said cough, I'm going to run a throat swab just for precaution.
It's negative.
All right. I believe the patient has malaria as well as typhoid fever, as well as a case of anemia following the malaria. So the malaria is 2+ and it's a 10, so it's okay. So I believe the patient has malaria with mild anemia because you said it was 10.5.
Yes.
Yeah.
10.1.
10.1. All right. Yeah, it's 10.1. So I believe patient has mild anemia as well as malaria on top of typhoid fever. So for the malaria, I recommend that the patient takes Coartem, or also known as ACT. And for the anemia, I recommend the patient takes oral iron supplements, so like little pills the patient can take, as well as eating more iron-rich foods like liver, meat, egg yolks, leafy greens, maybe like spinach. And for the typhoid fever, I'm going to recommend the patient takes Ciprotab, which is an antibiotic that can deal with the typhoid fever. And I also recommend the patient takes antipyretics to deal with the overall fever in general, as well as getting a lot of hydration and rest. And to prevent these diseases, I really recommend the patient, in general, has a healthier diet, like more iron-rich foods, more just like a healthier, more balanced diet, being clean, being sanitary. So, for example, like washing his hands before he eats and after he uses the bathroom, trying to use the restroom like inside instead of outside. And for malaria, I recommend the patient uses insecticide or like insect repellent, and using bed nets in order to prevent mosquitoes from coming in, because malaria is a mosquito transmitted disease. And in general, just kind of wearing longer sleeve clothing. And yeah.
Perfect. Excellent. Laura, I'm highly impressed. Really, I'm impressed. I think should you go on to become a doctor, I think you are going to be a good doctor. Perfect. Excellent. All the best.
All right. Thank you. Please tell the patient thank you for letting me diagnose him today, and I'm very honored.
Patients appreciate.
All right, bye, doctor. Thank you.
Thank you. Bye.